we think about rheumatoid arthritis, we often just think about rheumatoid arthritis, and we forget that that's just part of a person. And many people have other types of conditions. And when we've looked at this in people when they've just entered into the cohort, when they've just had their new arthritis, we find that over 3/4, over 75% of patients have another medical condition beyond their arthritis. So it's very common to have more than one medical condition. The most common one was hypertension, which is not unexpected because that's very common in the general population. But we also found high rates of endocrine conditions, hypercholesterolemia, thyroid disease, even higher incidences of diabetes as well. These were quite prevalent in the cohort. And importantly, mental health concerns like depression. We specifically looked at depression, but other studies have shown that anxiety is also very common in people with arthritis. And I think when we see that we're finding these conditions right at the very beginning of disease, it's something that we need to think about going forward. We know that when people have a comorbidity, it affects how they do over time with their arthritis. When we've looked at people who have comorbidity right at their first visit and looked at how they've done over 1 year, they're less likely to get into remission. They don't have as good a disease control. They're more likely to have more pain, and they're more likely to have more troubles with their function. So definitely the comorbidities seem to be associated with poorer outcomes. And the more comorbidities you have, the increased burden of comorbidities, the more problems you're going to have with poorer outcomes. Why this is, there's probably multiple factors leading to that, but the observation is there, and it's something that rheumatologists really need to be aware of and look for these other types of medical conditions because they may impact the outcome.